And so my talk today is talking about how to keep calm in the emergency room. And so how I try to do that in my daily course of work, and hopefully we can all gain some of the insights here and some of the methods that I use, and then we can try to use it in our daily life when we encounter emergency situation. So just a disclaimer: whatever I'm sharing here are solely my personal perspective and the views, and do not reflect any ways for the organization I work for. So as an outline, I want to talk about as an outline, I want to talk about what happens to our body when we're excited. I need to cover a bit of that just now about the stress hormones and the chronic stress and all this. I want to talk about it more in acute sense, acutely what happens. And I want to share with you some of the techniques I use to keep calm in terms of calmness on myself, calmness in the moment, and how our calmness affect other people. So I've been working in the emergency department for 16 years, and many years ago when I first started training as an emergency physician, there was one day I was working in the resuscitation room, and within a very short period of time, within 10 minutes, three very sick patients arrived in the emergency department. One, a motorcyclist who had a severe accident, another patient with an ongoing heart attack, and another sick patient with severe infection and was in shock. So the emergency room kind of looked like the picture from this clip taken off from the TV show ER. We don't have all the handsome actors and actresses, but it's kind of chaotic like this. And the nurses and doctors was running everywhere, shouting instructions here and there, everywhere. The resuscitation room was a chaos of activity. And I was just a young doctor, a young registrar, then trying to handle the motorcyclists, the 1,000 things that's happening, the things I need to do for the man. The man was groaning in pain. And right when I thought the chaos could not get worse, I saw my senior doctors walked into the resuscitation room, majestically pacing into the resuscitation room with this aura of calmness around him. He was just a sea of calmness just around him. And he looked at each patient and he barked instruction to the team one at a time, what to do, what to do, what to do. And then he walked off to help the patient in shock. And then order returns as we all settle down to do what is the needful thing for each patient and finish the shift for that day. So that moment, that scene has always been embedded in my mind. And that's when I realized how important it is to stay calm and collected in the emergency room. What happens when we are excited? Right. So I need to talk a bit about this. So when we are actually excited, we are humans. We evolved in the plains of East Africa about 1 million years ago. We have oversized brain, smaller and weaker muscles, and the animals around us, including animals that's going to chase and eat our ancestors. So it's natural that our forefathers have this inbuilt survival system to maximize the chance of survival. And over 1 million years of evolution, we have not lost it. We still have this kind of survival instinct, survival capability. So when we actually encounter excitatory encounters, our body naturally prime ourselves, and it primes ourselves very fast to react to this excitation, so as to increase our chance of survival. So powerful hormones like adrenaline will get secreted together with rapid firing impulses to optimize our body for what is called a fight or flight response, so that when the predator is chasing us, we can run faster to escape, or if we really need to, we can stand firm and fight it off. So what actually happens to our body? Our pupils will actually dilate. So stress hormones get released, our pupils get dilate, our heart rate increases, our blood pressure increases, so the more blood is being pumped across the body, the breathing rate increases so that more oxygen comes in, sweating increase, the muscle tense up, more blood goes in the muscle tense up so that the muscle can react faster. React faster. Pupils widen so that you get more vigilance. So that is called the fight and flight response. And this response is still retained in us. Although nowadays, of course, we don't have to run away from tigers chasing us, very unusual. But when we encounter exciting situation, we are still programmed to react in this manner. And it may be helpful in some situation, in some emergency situation, but it's not in most modern life situations, probably not going to be really useful. And by definition, the clinical problems that I encounter in my line of work in the emergency department, emergency situation, are supposed to be emergency. So thankfully, they are not all life-threatening, but it can be. And sometimes when patients are in life-threatening medical conditions or they have severe trauma, healthcare workers, being healthcare workers, we will also get excited, and then we can also get this fight and flight response, and this response is not really helpful in most cases, and it can actually hamper us in the things that we want to do. Why is that so? Well, imagine trying to execute a delicate medical procedure like inserting an IV line into a sick patient whose veins are already collapsed, with our hands shaking from the intense muscle tension. Imagine being excited, all ready to go, 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 and not thinking through the complex permutation of medical problems and treatment. Or imagine excitingly bursting around, screaming, shouting, and the poor patient watching with horrors, the chaos that's going on, and that's probably not going to help the patient very much. The consequence can be just a minor distraction to ourselves, but it can also distract other people. It can distract other healthcare workers. Being excitable, running around like headless chicken has a very unnerving effect on other healthcare workers, and it's going to disrupt their thought process. It's also going to disrupt their work process, and it's going to disrupt the duties that they perform. And of course, the most negative impact will be on the patient. They, other than being disturbed by meeting distracted and excited healthcare workers, there is for the help for the diagnosis, there is no patient space to listen to the important clue in the medical history. There is no cognitive, the physician has no cognitive space to process the important signs and symptoms. There's no important space to link all the medical picture together in a coherent manner. And in the end, the diagnosis can be missed and the treatment can be delayed or missed, and bad outcome can arise. So in my line of work, I actually value staying calm as an essential skill in especially in emergency room, and most probably in most emergency situation in modern life. So yes, that there is going to be sometimes our fight and flight response may help us in certain situation, but it's also good to put some space of thought in first to see if there's other more adaptive response before subjecting to this fight and flight response. So these are some things I do to stay calm in my work, and I'm hoping that you may find some of this useful. I think the most important aspect of preparing oneself to stay calm in emergency situation or in emergency room is the intrinsic value that one places in a collected response. Believing that being calm is a better response in emergency situation than the mindless hormone rage. At least it gives time to put some put some cognitive space to allow some evaluation of the situation first. So of course, in my case, I have the advantage of preparing myself in advance from the years of training and learning and repeated exposure, calibration, retraining and relearning. So that when I see a breathless patient coming in, I know what are the steps I need to do, what are things I need to look out for. That counts for a fair bit. And we are all thankful that we have robust training system that train our doctors in handling this situation. But naturally, of course, that is not always possible to prepare for everything. There will be still things that rise, even an emergency experienced doctor. So perhaps multiple trauma patients, perhaps slashing incidents, patterns of injuries or illness in a very sick patient that we've not encountered before. Right. So these are some slides of doctors in training. Right. So, and then of course, there is also a natural biological state. So it is not just the situation we not encountered before, but we can also get a wise person once taught me that we can get easily flustered when we are tired, when we are hungry, when we have multiple things competing for our attention, and this mental states also can rile us, can get us excited and anxious. And working in the emergency department, the work is both mentally and physically demanding. So it is not difficult to get tired, distracted, or hungry, or the need to just use the bathroom. So it is actually easy to get flustered. So it is useful to have some tricks to have some tricks to keep myself calm. So what do I do? Well, I start in the first thing in the morning with mindful sitting. And I find myself sitting in the morning gives me the most clarity of the mind. The mind is least disturbed by flying thoughts. I can be most mindful of my subject and my mental state. And I guess I'm busy like everybody else here, so I don't have much time to sit. I wish I had more. So typically I sit for about 15 minutes in the morning if I can. I like it especially if I'm on a morning shift. I will drive early to work, and then I will find a quiet car park lot and I park the car, lock the car door, and then I will sit quietly for 15 minutes. And then if I sit long enough, sooner or later people start seeing you in a car, locked and not moving, and then of course people start wondering if you're okay, and then this kind of things happen. Yeah, but it's kind of good because the world needs to see more mindfulness in action. And then there's added bonus because sometimes I'm really tired and I fall asleep during the morning sitting, and then I just get another 15 minutes of extra rest. So that's sitting, but the mindful practice does not just consist of just sitting. I have this really nice, wonderful path that I walk from the car park to the office. And after sitting, I will walk quietly and mindfully to the office. And being present there, keeping the mind on each feet and each leg as it carries me to work. Now, over time, I realized the path becomes a mindful path filled with joy and gratitude. And every time I walk the path, my mind naturally habituates to being present and quiet and with ease. It is not a long walk, but that few minutes actually calms the mind a lot and grounds me a lot. And this is the path that I pass by, that I walk through. This wonderful path. Looking at it, it give me a lot of calmness, and this over months of habituation. And it passed by the mortuary. So I talk about yeah, that's my path. I talk about calmness and how being uncalm can rile others and affect others. I want to talk about how our calmness can affect others. Um, very very often, emergency department gets very, very crowded, and waiting time will increase. So many times, patients actually do have to wait a certain duration of time before they can get seen by doctors. And it's worse when the whole place is congested, when it's a very busy shift, lots of noise, lots of patients in discomfort, um, and sometimes it gets bad when patients and relatives start getting upset, and then perhaps because they're also tired, they have some other place to go, they're hungry, then they demand to get seen, and then they started becoming obnoxious. They can start shouting and sometimes threatening. Now, we understand how difficult it is for patients and relatives, and at times, but it is also very difficult for the healthcare providers. Patients who are sickers have to be attended to, be given priorities. The place is congested, a lot of patients to be seen, things to be done. So there's a lot of added stress. And then on top of that, the screaming and distressed individual. So it's not easy, but this is how powerful being calm can be. So it is one of these heavy shift, crowded emergency department, many ambulance arrival, the floor is crowded and bustling. Something that look like the picture. It's not as crowded as this, but it's fairly similar. Doctors, nurses rushing everywhere, crowded, congested patients. So one of the patients, many ambulance arrival, one of the patients was obviously uncomfortable, was put on a trolley and obviously uncomfortable. And then she started having anxiety attack. So we can hear her started to scream a bit, shake the trolley a bit. But all the doctors were really busy and they were attending to a really sick patient. And then the patient got more and more uncomfortable and then started shaking the trolley more violently. And and then after a while started shouting and screaming and shaking it really violently and going to a full-blown attack. So at that moment, it had just happened that one of my colleagues had finished what he was doing, was able to put down his things, walk up to her calmly, and she was still shouting and screaming. But my very experienced colleague persisted and gently talked to her, gently moved her to a more quiet place of the department, and continued talking to her calmly, very, very skillfully and remarkably. And very interestingly, you can see the patient actually slowly calm down and eventually settle down. So with calm, gentle, but persistent instruction to calm herself down, my colleague is actually able to gently settle down a quite disturbed patient without having to resort to physical or chemical means of restraint. And that is remarkable, how powerful calmness can be on other people. I do that also with medical officer. Young doctors need to learn this procedure called intubation. So highly skilled and very intense procedure. The doctors have to insert a breathing tube like this, a breathing tube into the airway, which you can see the airway is flexed at an angle. So you have to use a blade to visualize the airway and then insert the breathing tube. And it is a time-sensitive procedure. Any delay or inability to get the tube in can mean death or brain damage to the patient. And it is also, and as you can see, it's not easy and it's time sensitive. So you can imagine how a young doctor can feel very, very stressed and very, very excited when called upon to do this. So it's practically life and death situation. And sometimes it can be difficult to do this procedure. So when I am on resuscitation shift and I'm supervising a junior doctor doing the procedure, so I like to speak as calmly as I can. I encourage the young doctors. I reassure them to have trust in their training, that the procedure is going to be easy. So I'm almost talking to them as if they have successfully completed the procedure. So I'd like to put them at ease and calm them down because I know that that is the best way for them to succeed calmly and steadily instead of being excited and having their hands shaking and breathing hard. And that is one of another instance how being calm in the ED can affect other people. Some of you may know this. This is an example that's outside ED work, and some of you with young children may know this or can actually go and try this out. Sometimes some parents bring their young children to see doctors and dentists, and the children will be crying, resisting, afraid of what painful things the doctor is going to do. But where do the children get that kind of vibes from? Actually, they learn it. They learn it by observing the reaction of the parents. Parents who themselves are excited, are very concerned on how their children will react, tense up, and then the children can see that their parents tensing up, and they'll be wondering what bad things is going to happen. Why is my parents tensing up? Then they become fearful, and then they will start crying and screaming when a stranger approach. Whereas parents who know this or who are actually calm and behave in a slightly nonchalant manner, the children are actually relaxed because they don't see that vibes from the parents. And then they become curious, then they cooperate with the treatment. So if you have young children, you can try this out and you can see that, yeah, actually our calmness, our mental stage can have a lot effect on other people. So finally, I'm going to go and talk about calmness and the moment. So for calmness and myself, I value calmness. I practice and both sitting and both walking before I get to shift. But on the shift itself, at that very particular moment, how do I invoke this calmness? I think being trying to remember to be calm at the moment is not always the easiest. Being being mindful at the moment when things are happening and all this is really not the easiest. This mental state of mindfulness is difficult to almost impossible to come by when there is a lot of communication going on, like in the emergency room, and added to the speed of things that's happening, the information that the healthcare worker has to process, and sometimes the discomfort the healthcare worker may be facing, like hunger, stress, or being tired. So I must say that many times upon reflection, I wish I had been more calm also. So I don't think it is possible to suddenly one day decide that, okay, I'm going to be calm and mindful in the emergency room, just like that. I think it has to be cultivated and worked on over a sustained duration of time, making it a habit to be mindful and calm so that during an emergency, these mental habits come into play, kicks in, bringing bringing the awareness to one's mental state, to one's biological state, and staying grounded at the moment. For myself, I find it easiest to center myself using my body as a base to bring my mind to the present moment. Maybe that's because of my sitting or because of my walking. So I find that my body is the most easiest way to bring myself, to ground myself. And I suppose different people use different objects so to center themselves. Some may find using their breath, some may find using their feelings easiest. Um, the when anxiety comes up, it can comes up very, very fast. And one of the few emotions that can comes up that can then react as fast as anxiety is actually love and gratitude. And if you can actually master, if you can actually um, turn your attention to something that you have a lot of love or gratitude towards, because the mental space can be only occupied by one emotion. So if you can turn the attention to love and gratitude, that emotion can actually displace the whatever anxiety and panic that's happening. And we all know that love and gratitude, these emotions are associated with mindfulness. So that's something that's something that's very useful. Perhaps you might think of a kitten, think of your little child. So those are powerful. Those are techniques we can use. I noticed that at work, sometimes people hum music. This is a bit controversial. I don't know. I suppose the music calms people's nerve, or the tune itself may be calming. But at least I think perhaps the music brings the mind to a more quiet place for a while. And then there is this idea called resilient mindfulness, which Anita also talks about. And this is something also to be mindful of. It is useful and important to remind ourselves of this resilient mindfulness, or what is called a sense of coherence. That it is actually that our mind actually has resilience. We have the reserve. Whatever encounter that we are going to encounter is going to be comprehensible. Okay, it's going to make sense, and we actually have all the resources and all the capability to manage the experience. And the experience is going to give meaning. We are going to grow from it, and we're going to grow from it, from the encounter, to be wiser, to be stronger. So there is actually no need to panic or to become anxious. So this part I call the mindfulness of resilience. And so it's helpful to stay calm also. Right. So, well, it is not young doctors who only face challenge. Older doctors like myself also face our own challenge, less often, but it is a challenging moment. And but it does have we do have challenging moment. I think there's one night shift not long ago. The patient was brought in after being rescued from a fire. So fire victims are particularly hard to resuscitate. There are all the graphic burns on the body. The smoke can affect the airway of the patient, causing the airway to swell up and close up, and the patient can literally choke and die. The smoke can go into the lung, damage the delicate tissue that's used for air exchange. And the toxic compound in the smoke can enter the blood and cause poisoning. So the victim can also suffer from physical trauma that for being thrown in the explosion. So I think a lot of things can go wrong, and there's actually a lot of things the healthcare team needs to do just to keep the patient alive. So that was one night shift when the victim was rescued from a fire and brought to the emergency department. Now, one victim is really no good. But a house fire at night can have many victims, and especially at night. And at night, there's not so many staff in the emergency room. And this victim looks really badly burnt, and so the fire must be big. His voice was all muffled, and because his airway was closing up. So it is yeah. So it's an emergency situation, right, for panic. We didn't have much time. There was me, my MO, my junior doctor, and my specialist in training, the registrar. We attended to him immediately, getting the medicine into him, the pain medicine, the sedation medicine, getting the sedation medicine into him, prepare to secure a breathing tube in his airway, the procedure called intubation that I mentioned earlier, before the airway closed up. Um, and it is a challenging procedure in good time, and in this is bad time, because sometimes we can actually tilt the neck to give us more visualization, but in this case, because there is trauma involved and all this, we couldn't turn the neck very much, so we have very little visualization. So my junior doctor, a really good chap, had a go first attempt at intubation. He had a video scope attached to the scope device. He has a video attached to the scope device, and this is a very modern setup with the best chance of success. He could not see the airway. So the specialist in training then had to take over. But she went in, she couldn't see the airway also. And these are the challenges of more senior doctors. So whenever procedures that the junior is unable to do, the bucket will fall on us. The easy fruits have been picked, but the difficult ones we had to take lah. So anyway, I step in, and as I insert the scope, I realized why the other two doctors had so much difficulty, because I too could not see where the airway of the patient is. And then, and remember, we only have a few minutes to do this, to save this patient's life. And this is a moment ripe for panic. And at that moment, I I I saw what I thought was the wall of the airway, and then a trail of dark, sooty secretion coming out from it. Everything else was coated in soot, but there was a trail of sooty secretion coming out from it. And I realized that is probably the airway. And being focused on that moment, I remember everything around me seems to have dimmed away as I just focused on that trail of soot and gently insert the breathing tube into the airway. And thankfully, the tube was in place, and we could give the victim, we could proceed to give the victim oxygen and address all his other issues. And it was, in retrospect, it was a nerve-wracking moment. I guess I was very, very thankful for the team that supported me, and the moment when I could calmly focus on the tube. And I'm sure that if I have in a panic mode, in a fight and flight mode, my hands will be trembling, my heart's racing away, my breathing heaving up and down, all the fast breathing, I certainly would not be able to insert the tube so smoothly and would have put the victim's life in jeopardy. So I think in reflection, I hope that I shared with you some of the things that I do to keep myself calm in emergency department, the inherent value that I put into calmness and mindfulness, the commitment to have as often as possible daily practice, incorporating our daily practice into our work, and so that in the moment it comes, we can then find the base that we can bring ourselves back to mindfulness as fast as we can. Um, yeah, so at the time, at the moment of need, and always to remember the sense of coherence that everything that we encounter is comprehensible. That we actually have the resources to manage them, and they are all going to make us stronger and wiser, and we'll be able to overcome them. So there's no need to panic, or yeah, and we just stay calm, and we should be able to sort things out. And thank you.